Your mom forgot where she parked the car. Again. Your dad asked you the same question 3 times in a single hour. It is easy to shrug it off and say, they are just getting older. But what if these moments were actually quiet warning signs of something much more serious? Something doctors can often help with. If it is found early enough, vascular dementia is the second most common type of dementia after Alzheimer's, and it affects millions of people over the age of 60. What really surprised me while researching this topic is how often the earliest clues are completely overlooked. For months, even years, families assume everything is fine. By the time someone finally sees a doctor, a lot of brain damage may already have taken place. In this video, I am going to walk you through 8 early warning signs of vascular dementia that every person over 60 and every family member should know. Sign number 3 is so easy to miss that even people who live in the same home often do not notice it at first. But once you understand what to watch for, it becomes very hard to ignore. Before we go any further, I need to make something absolutely clear. This video is for education and awareness only. If you recognize any of these signs in yourself or someone you love, you must talk to a doctor as soon as possible. Only a qualified medical professional can diagnose vascular dementia. These signs on their own do not prove anything, but they are strong reasons to seek a proper medical evaluation. With that in mind, let us look at the early warning signs that, if caught in time, could help protect someone's thinking memory and quality of life. Sign number 8, sudden trouble with planning or organizing. This is not about the occasional forgotten appointment or putting your keys in the wrong place. What we are focusing on here is a noticeable sudden change in someone's ability to carry out familiar, step-by-step tasks they have done smoothly for decades. Imagine this. Your father has cooked his signature Sunday breakfast every week for 20 years. He does it from memory. Eggs toast, bacon coffee always prepared in the same sequence. But one Sunday, something feels off. He is standing in the kitchen looking uncertain. The eggs are burning in the pan, the toast is still cold on the counter, and the coffee pot has not even been turned on. He looks confused in the middle of a routine he used to do without thinking. This kind of change is what doctors describe as a decline in executive function, and it is often one of the earliest warning signs of vascular dementia. Here is what is happening behind the scenes. Vascular dementia develops when blood flow to parts of the brain is reduced, usually because of tiny strokes or damaged blood vessels. When these small strokes affect areas that handle planning and organization abilities that were solid yesterday can suddenly disappear today. The key idea here is sudden change. Alzheimer's disease usually worsens slowly and steadily over many years. Vascular dementia, on the other hand, often progresses in steps. A person seems stable, then has a small stroke, and their functioning drops to a new lower level. Studies published in the Journal of Neurology report that problems with executive function show up in roughly 60% of people with vascular dementia and often appear before obvious memory loss. The person may still know names, dates, and faces, but they cannot put those pieces together into an organized action plan. What makes this sign so easy to overlook is how naturally families step in. Without realizing it, you start doing more for your loved one. You take over paying the bills, setting up pillboxes, planning meals and appointments. It feels like you are just helping out, but in reality, you might be covering up an important red flag that needs medical attention. If you see a loved one suddenly struggling with tasks they once handled confidently, do not ignore it. Write down concrete examples and note. When you first notice the changes, then book a doctor's appointment as soon as you can. Early evaluation and treatment can help slow the progression of vascular dementia. And there is yet another early clue, one that can show up even before these planning problems, and it has to do with what happens while your loved one is asleep. Sign number 7. Growing confusion or disorientation in the evening. Doctors have a name for this pattern, sundowning, and it is a powerful early clue of vascular dementia that many families mistake for simple exhaustion. Here is how it often shows up. All day long, your mother seems completely fine. She is engaged, remembers conversations, and follows what is going on around her. But as late afternoon turns into evening, something changes. She suddenly is not sure what day it is. She cannot remember whether she has already eaten dinner. She may even seem unsure where she is or insist she needs to leave the house right away for no clear reason. This is not just being worn out at the end of the day. It is a distinct pattern of thinking and orientation problems that reliably worsens in the evening hours. Studies in the American Journal of Geriatric Psychiatry suggest that up to 20% of people living with dementia experience sundowning, and it often shows up earlier in vascular dementia than in some other types. What is going on in the brain? In vascular dementia, blood vessels are damaged and can no longer deliver a steady supply of oxygen and nutrients to brain cells. Your brain relies on that blood flow to function. As the day goes on and the body naturally tires, the brain has even less reserve to draw from. Areas already weakened by poor circulation struggle more, and the result is a noticeable uptick in confusion. On top of that, evening darkness removes many of the visual cues that usually help someone stay oriented. In daylight, familiar sights and surroundings anchor the brain. Once the lights dim and shadows deepen, those anchors fade and disorientation intensifies. This sign is especially important because it can appear months before more obvious dementia symptoms. Families often explain it away. They say their loved one is just overtired or needs a better sleep schedule. But recurring evening confusion is not something to ignore. It warrants prompt medical evaluation. If you start to see this pattern, keep a simple journal for about 2 weeks. Write down when the confusion starts, what seems to bring it on, and how long it lasts. Bringing this record to the doctor can make it much easier to understand what is happening and reach an accurate diagnosis. And now, we come to a warning sign that almost no one recognizes at first, the one that can slip past even experienced clinicians during routine visits. Sign number 6, struggling to find everyday words. Everyone has moments where a word is on the tip of the tongue. That is normal, but there is a particular pattern of word-finding trouble that points toward vascular dementia. A person may start a sentence smoothly, then suddenly stop in the middle. They know exactly what they want to say. The idea is clear, but the word itself disappears. They might swap in a related word like calling a fork a spoon or a car a truck, or they work around the word by describing it instead of naming it, saying the cold food box instead of refrigerator. And this is not a one-time slip. It happens repeatedly in the same conversation. Research published in the Journal of Alzheimer's Disease shows that about half of people with vascular dementia develop word-finding difficulties within the first year. The pattern is different from Alzheimer's disease, where vocabulary fades slowly over many years. With vascular dementia, word retrieval often becomes difficult more suddenly and can change dramatically from day to day. One day speech sounds almost normal. The next day the person struggles with simple words. This inconsistency happens because vascular dementia disrupts blood flow to language areas in the brain in an uneven way. A small stroke in a region responsible for word retrieval can suddenly make speaking much harder, while nearby areas may still work fairly well, creating this up and down pattern. Families often overlook how upsetting this is for the person. They are aware something has changed. When words vanish mid-sentence, they feel embarrassed or anxious. Many begin to avoid talking, not because they are antisocial, but because they are trying to hide the problem. Loved ones may wrongly assume they are depressed or withdrawing from others. If you notice this kind of word-finding pattern, resist the urge to jump in and finish every sentence. Give them time to search for the word themselves, but quietly keep track of how often it happens and arrange a medical evaluation. Changes in speech and language should always be assessed by professionals because they can reveal specific kinds of brain damage that may respond to treatment or therapy. Next, we will look at a symptom that shows up in social settings and gradually transforms the way a person behaves around other people. Sign number 5, difficulty following conversations or TV storylines. Your dad is watching his favorite series, the one he has followed for years. Suddenly he turns to you and asks, "What's going on? Who is that? Why did he do that?" You explain the scene. 5 minutes later, he asks the same questions again. This is not a hearing problem. It is a problem with processing and keeping track of information. In the early stages of vascular dementia, The brain struggles to hold several pieces of information at once and connect them into a clear story. Research from the Alzheimer's Association suggests that about 65% of people with vascular dementia have trouble following complex conversations or plots early in the disease. The core issue is something called working memory. You can think of working memory as the brain's scratch pad, where it temporarily stores and manipulates information. To follow a conversation, your brain has to remember what was said a few seconds ago, link it to what is being said now, and predict where the discussion is heading. When vascular dementia damages small blood vessels in the frontal lobes, these working memory circuits are disrupted. The person hears every word, but cannot hold the information in mind long enough to understand it in context. They lose track of who said what or why it mattered. TV shows become confusing because they cannot remember characters introduced earlier or follow the plot across commercial breaks. Family gatherings with several people talking at once and jumping between topics become exhausting. There is too much incoming information and not enough mental capacity to organize it, so they quietly withdraw from conversations they once enjoyed. Families often misread this withdrawal as disinterest, mood changes, or just getting older, instead of recognizing it as a sign of cognitive decline that needs medical attention. If you notice someone struggling to follow conversations they previously managed easily, try to simplify the setting for important talks, turn off the TV, reduce background noise, and let one person speak at a time. Keep messages short and clear, but above all, arrange a professional cognitive evaluation. These difficulties with processing and tracking information point to specific brain changes that doctors need to investigate. Next, we will look at a warning sign connected to something we all do every single day without even thinking about it. Sign number 4, problems with depth perception and spatial awareness. This warning sign often shows up in ways that do not seem connected to dementia at all. The person suddenly has trouble judging distances. They reach for a cup and their hand stops short or knocks it over. They misjudge the height of a curb and stumble. Parking the car becomes harder because they cannot accurately tell how close they are to other vehicles. Stairs start to feel unsafe because each step looks the same, making it difficult to know exactly where to place their foot. These issues are not caused by poor eyesight in the usual sense. The eyes may see clearly. The problem lies in how the brain interprets what the eyes are seeing. Vascular dementia can damage brain regions that handle spatial processing. The occipital and parietal lobes work together to create your three-dimensional picture of the world. When small strokes affect these areas, depth perception and spatial awareness begin to break down. Studies reported in neurology journals show that visual spatial difficulties appear in roughly 40% of people with vascular dementia, often before clear memory problems. These changes greatly increase the risk of falls and make activities like driving particularly hazardous. One of the most dangerous aspects of this sign is that the person usually does not realize anything is wrong. They feel confident that they are judging distances correctly. Their brain simply is not sending warning signals that their perception is off. So they keep driving, climbing stairs, and moving through crowded spaces with a false sense of security. Family members should watch for small but important clues. A rise in minor bumps and accidents clipping door frames. They used to walk through easily spilling drinks when setting them down, struggling with fine tasks like threading a needle, or having newfound difficulty with puzzles or hobbies that require precise visual judgment. These little changes are not trivial. They warrant prompt medical evaluation. Caught early, doctors can treat underlying vascular issues slow, further decline, and put safety measures in place to reduce falls and other accidents. Next, we will look at a different kind of signal, one that shows up in emotions and personality. Sign number 3, subtle changes in walking or balance. This is the sign that surprises people most because we rarely link the way someone walks with the health of their brain. But we should. Your gait is like a window into your brain function. Vascular dementia does not only affect memory and thinking, it also disrupts the brain areas responsible for movement and coordination, and those changes can appear before any obvious memory problems. A major study from the University of Toronto followed more than 4,000 adults over 65 for 5 years. Researchers found that changes in walking speed and stride length predicted dementia years before diagnosis. In people who later developed vascular dementia, these gait changes appeared on average 3 years before they were formally diagnosed. So, what do these early movement changes look like? The person starts taking shorter steps without noticing. Their walking speed slows down, especially if they have to think or talk while walking. They may begin to shuffle instead of lifting their feet, clearly pause before stepping off curbs or through doorways, and feel less steady when turning or changing direction. This happens because walking is surprisingly complex for the brain. It must coordinate muscles, keep balance, process what the eyes see, and plan where to step all at once. When small strokes damage the brain regions in charge of these tasks, the signals to the body become less precise, and walking loses its smooth, automatic quality. Families often miss this sign because they assume slower, unsteady walking is just normal aging joint pain or arthritis. But when changes in walking appear together with any level of mental confusion, memory lapses, or difficulty concentrating, it is a strong warning sign of vascular dementia and needs urgent medical evaluation. Pay special attention if walking becomes noticeably worse when the person is distracted or talking at the same time. This two things at once problem is particularly revealing. The brain simply cannot handle both when blood flow is impaired. If you notice these patterns, arrange a full medical checkup that includes both memory testing and a neurological exam, and do not accept it as just aging as the only explanation without proper investigation. Sign number 2, sudden emotional changes or loss of emotional control. Your usually calm, steady mother suddenly breaks down crying during a simple TV commercial. Your father, who rarely raised his voice in the past, now snaps in anger over the smallest inconvenience. These dramatic shifts are not bad moods or just getting older. They are often neurological symptoms of vascular dementia. When tiny strokes affect brain regions that govern emotion, the brain can no longer properly regulate how feelings are expressed. Mild irritation can explode into rage. A touching scene can trigger intense, uncontrollable sobbing. The person might laugh at completely inappropriate times or sit expressionless during genuinely sad news. Doctors call this emotional lability or pseudobulbar effect. Studies suggest that up to half of people with vascular dementia experience it at some stage. The problem arises when damage to the frontal lobes and their connections disrupts the circuits that usually keep emotional reactions balanced and appropriate. For families, this is especially painful because the outbursts feel personal. When someone you love yells at you or cries endlessly, it is natural to feel hurt or blamed. But these reactions are not a reflection of their true feelings toward you. They are symptoms of brain damage they cannot fully control. Research in the International Journal of Geriatric Psychiatry shows that emotional changes often show up 6 to 12 months before families finally seek medical help. During that time, relatives usually explain it away as stress, depression, or relationship conflict, and try to fix it with patience, reassurance, or better communication, instead of realizing these are neurological warning signs. Watch carefully for specific patterns. Sudden mood swings that are far bigger than the situation calls for. Crying or laughing that goes on longer than makes sense. Bursts of anger that appear out of nowhere and fade just as quickly. Or the opposite, no visible emotional reaction in situations that would normally make someone sad, worried, or moved. If you see these changes along with any of the other signs we have discussed, arrange a medical evaluation right away. Doctors can investigate whether vascular damage in the brain is behind these symptoms and may offer treatments to help manage them. Now we reach the earliest and most easily overlooked sign of all, the one that often starts so quietly, almost no one recognizes it as a problem. Sign number 1, sudden urinary urgency or frequency without infection. This sign surprises many people because we rarely connect bladder control with brain health, but the link is very real. In the early stages of vascular dementia, when damage begins to affect the brain areas that manage bladder signals, one of the first clues can be sudden intense urges to urinate. The person feels they have to go right now with almost no warning and may not reach the bathroom in time. Yet medical tests show no urinary tract infection, no enlarged prostate, and no clear bladder disease. Studies report that up to about 30% of people with vascular dementia develop urinary symptoms early on, often before family members notice clear memory or thinking problems. The reason lies in the frontal lobes, the part of the brain that helps regulate bladder control. Small strokes in these regions scramble the communication between brain and bladder. The bladder may send urgent signals when it is not really full, or the brain may fail to register normal signals until the very last moment. What makes this especially important is that the connection is often overlooked. A person goes to the doctor, reports new urgency or frequent urination, is tested for infection and other urological issues, and when everything looks normal, the changes are dismissed as simple aging. The possibility of an early neurological problem is never raised. If you or someone you love suddenly develops urinary urgency or very frequent urination that cannot be explained by infection, prostate problems, or other bladder conditions, and especially if any of the other signs we have discussed are present, do not stop at basic urine tests. Ask for a full neurological workup, including cognitive testing. This combination of bladder changes and subtle brain symptoms is a strong clue that vascular changes in the brain may already be affecting function. If you recognize several of these signs in yourself or someone you care about, try not to panic but do take action quickly. Here is what you should do next. First, start writing things down. Note specific examples of what you have seen, when each symptom began, how often it happens, and what seems to trigger or ease it. This simple record will give doctors a much clearer picture of what is going on. Next, book an appointment with a primary care doctor as soon as you can. Do not wait to see if things get worse. Early action can make a real difference in how vascular dementia progresses. Bring your notes with you and ask for a full workup that includes cognitive tests, brain imaging, and an assessment of blood vessel health. Be prepared to speak up if someone brushes it off as normal aging and calmly insist on a thorough evaluation. While you are waiting to see the doctor, do what you can to support vascular health. Keep blood pressure under control. Manage diabetes carefully. Stop smoking if you smoke, choose heart-healthy foods, and move your body regularly. All of these steps help improve blood flow to the brain and may slow or even prevent further damage. This is one of the key differences between vascular dementia and Alzheimer's disease. The root problem is in the blood vessels. When doctors treat those vascular issues early, they often can prevent or significantly slow cognitive decline. That is why recognizing early warning signs is so important. It is also essential to remember that having one or two of these symptoms does not automatically mean someone has vascular dementia. Many other conditions can look similar. Only a proper medical evaluation can reveal the true cause. But noticing these changes early and seeking help promptly can protect someone's thinking independence and quality of life. Which of these 8 signs surprised you the most? Have you noticed any of them in yourself or in someone close to you? What would you like to know more about when it comes to vascular dementia? Share your thoughts in the comments. Your story may help another family recognize what is happening. If this video made things clearer for you, please like it and subscribe to our channel. We make evidence-based health content for people over 60 and their families. And do share this video with anyone who might need this information. Early recognition can change the entire course of this disease. Knowledge only helps when you act on it. So, if several signs sounded familiar, make that doctor's appointment today. Your brain health is worth protecting.